my name is Martin Metz. I'm Professor of Dermatology and Allergology. I'm Deputy Director of the Institute of Allergology at the Charité in Berlin, Germany. And I have the pleasure and privilege to report some new data here at the EADV. And one of the possibly most exciting ones that was selected as an oral late-breaking presentation is on the effects of remibrutinib in chronic spontaneous urticaria. So remibrutinib is a BTK inhibitor that has been shown before, and we have published this in CSU. So it is a very effective drug. It does work in our patients with CSU. What we have done now is to look more closely into effects that are not directly related to the mast cell, but rather to the B cell. Because BTK is also downstream of the B cell receptor, not only in the mast cell, downstream of the IgE receptor, but also in the B cell receptor. So there has always been the hypothesis that this will affect the autoantibody levels in our patients with CSU. And this is exactly what we looked at. So we used the patient population from the phase 3 trials, from the REMIX 1 and 2 trial. So there's a large number of well-characterized patients where we took blood at baseline week 24 and at the end of treatment week 52, and then looked for autoantibody levels. And that was looked separately at for patients that have features of type 2B autoimmunity. So these are patients that are positive in the basophil histamine release assay versus those that are not these type 2B patients. And the result was that indeed we do see elevated levels at baseline in these type 2B autoimmune CSU patients. And these autoantibody levels, they are reduced during treatment with remibrutinib. And there's no change in those that received placebo. We further on looked at B cell characterization and identified that there is indeed also a decrease in the non-switched B cells. So these are the B cells that are thought to be the main producer of IgG autoantibodies. And they don't become regular long-lived plasma cells that are relevant for the normal IgG. And finally, we also look at B cell activation marker, that is CD23, soluble Fc epsilon receptor 2. And here we again saw an activation, so a higher level of the soluble CD23 in these type 2B patients at the baseline, indicative for an autoimmune disease. And this is then reduced during the treatment with remibrutinib. Now, this is at the moment descriptive data. So what we have to do now is to correlate this with the clinical outcome, see is there a meaningful relevance for this reduction in the autoantibodies in terms of efficacy during the treatment period, but we also have to look at the time after cessation of treatment, whether this reduction in autoantibodies may lead to something like a disease modification and will help our patients also in the long run so that they're free of symptoms even after stopping the drug. So thank you very much for listening.